I am Dr. Chava Anjaneyulu, Senior ENT Specialist. I am working with the Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center is having the facilities to diagnose, treat. All advanced diagnostic tests are available and all advanced, highly technically advanced instruments are available to treat the ENT problems. Mainly tinnitus, vertigo, hearing loss, nasal allergy, snoring, adenotonsil problems. All these we are treating with high technology instruments and patients are getting excellent results. Nowadays snoring is a very common problem. Snoring is increasing day by day. We should not neglect the snoring. In olden days mainly snoring will happen in elder people. People may neglect but they will face severe problems. But nowadays in young people, children also having severe snoring problems that will indirectly cause severe health issues. This snoring problem immediately causes the sleep disturbance and day-to-day activities. Daytime they can't perform very well in either school or those who are working in their workplaces, where they feel always sleepy because of lack of sleep in the night time, especially deep sleep. In elder people also this may be due to any tumors. Rarely dangerous tumors will also cause the snoring problem. Especially if snoring problem associated with the sleep disturbance, that means in our body the oxygen levels are decreasing. So hypopnea attacks will happen. This will increase our health issues, mainly stroke attacks. Especially some people die early morning because of the cardiac arrest, and severe problems like cardiomegaly and pulmonary hypertension will happen. So snoring and mouth breathing we should never neglect, and we have to investigate and we have to treat very early. In children the common problem for this is mainly adenotonsil problem, adenotonsillar hypertrophy and epiglottis problem. It is very simple problem. We can cure with the surgery with coablator or laser, that is adenoidectomy and tonsillectomy. Along with the epiglottoplasty, these kids will get very good relief and they will relieved from their snoring and mouth breathing problem and their long-term side effects. Young people mainly due to obesity. Those who are obese, they will have thick neck. If they are having short neck, this thick and short neck will cause severe apnea syndromes. This obstructive sleep apnea is very dangerous, especially in obese patients. These will have cardiomegaly, pulmonary hypertension, stroke, diabetes mellitus and kidney problems also. First, more important, you have to reduce your weight and get treatment for the obstructive sleep apnea syndrome. In elder people, mainly those who are having snoring, mouth breathing, we have to rule out nasopharyngeal tumor and oropharyngeal tumors. These are sometimes benign tumors, sometimes these are malignant tumors, sometimes anterior cervical osteophytes also cause breathing problem and snoring problem. So diagnose the condition, treat properly. For further updates, if you have any problem, contact Asian ENT Care Center located in Panjagutta, Hyderabad.